Okay, so today we're going to discuss the amniotic fluids. So, amniotic fluid analysis is basically for the following. So, we are doing that. Number one, for cytogenetic studies to check if the baby not yet born here would have chromosomal defects that would result here to some abnormality. Second one, also check here for some fetal lung maturity, especially if the baby would be suffering here with the fetal distress that might provide the information for the physician if the baby is going to be delivered or not, even the baby is premature. So again, your amniotic fluid here could be found in the amniotic sac. It's a membranous sac that tries to surround here the baby. So we have here the function of your amniotic fluids. Number one, so amniotic fluid here provides protection or caution here to the baby. And second one, it tries to regulate the fetal movement. And third one, try to regulate the body temperature of the baby. And the fourth one also help here for the maturation of the lungs of the baby throughout the development. Okay, then we have here the volume of your amniotic fluid here is actually the balance between your production and your reabsorption. So production here is the amniotic fluid volume is basically came from number one, from the urine of the baby, and second one, from the secretion of the respiratory tract when the baby started to have a breathing movement. At the same time, to prevent too much of your amniotic fluid here to accumulate in the amnion or membranous sac, so some of the fluid here should eventually be reabsorbed. So, paano siya ni-reabsorb? The first one, the baby tried to swallow. So, kinakain niya. At the same time, we have also here your intramembranous flow that would allows the movement of the amniotic fluid here within your amniotic sac into the vascular system of the baby. And therefore, that would regulate the volume of the amniotic fluid within the amniotic sac. Okay, so what happens here with the volume of your amniotic fluid throughout the pregnancy? So with the volume of your amniotic fluid here, so throughout the pregnancy, try to increase. It try to reach its peak at the end of your third trimester. Pregnancy could go as high as 1 liter. But right before the delivery of the baby, it try to decrease its volume. Okay, so for the production, so during the first trimester pregnancy, 35 ml of your amniotic fluid came from the maternal circulation. And toward the middle portion, the baby started to produce already here the secretion from its respiratory tract. And then you can check when the baby started to breathe already here, so it would already have produces also the secretion coming from the respiratory tract. And that secretion is made up of high-level the phospholipids. And after that one, after the first trimester pregnancy, the baby started also to urinate. So as soon as the baby urinate, the baby also started to swallow. So may pinuproduce siya galing sa ihi niya, at the same time pinaswallow niya, and therefore able to maintain the normal volume of the urine. Okay, then we have here some of the conditions that would eventually disrupt here the balance between the normal production and reabsorption. So first one, we have the term polyhydramnios, characterized here by excessive amniotic fluid volume, the amniotic sac. So too much volume here may be related to your fetal distress, related to your neural tube defects like your spina bifida or even your anencephaly. And that might be related to the following condition as well. So we have here your structural abnormalities. We have also here the cardiac arrhythmias, congenital infection, and we have also here your chromosomal defects. On the other hand, decreased volume may be related here to bakit sobrang baba, konti ang volume niya, it might be sobrang swallow niya. Okay, so we have here increased swallowing. Okay, increased swallowing or even defects here in the urine production. So, renal structural abnormalities. Or it might be because na sobrang baba niya because nag-leak ang fluid. So, all of this one result to your compression of the heart of the baby, and that might decelerate the heartbeat and it might lead to death of the baby pag sobrang wala na siyang amniotic fluid volume. Okay, the next one, we have here the chemical composition of our amniotic fluid. Amniotic fluid here, volume, or amniotic fluid is primarily being provided here by the placenta with its solute and in also the water concentration. On the other hand, we are expecting that the amniotic fluid will be the same as maternal plasma because again, they share the same composition, they share the same circulation. But then, of course, the amniotic fluid will be added aside from the maternal plasma. It is being added also here by the fetal cells coming from the different part of the fetus body, like in the skin, digestive tract, and even its respiratory tract secretions. For the chemical constituents of your amniotic fluids is made up of your bilirubin, you also here the lipids, enzymes, electrolytes, your nitrogen substances or your BUN, blood urea nitrogen, and we have also here your proteins. However, the composition of amniotic fluid try to change here as soon as the baby started to urinate. So as soon as baby started to urinate, the level of the BUN, creatinine, and uric acid, which are the kidney function tests, try to increase, whereas the glucose and protein try to decrease. We could also use here the parameter creatinine, the level of the concentration of that for us then to assess for the age of gestation of the baby. Like creatinine value here less than 2 mg per dl signify that one is less than 36 weeks. So pag more than 36 weeks, expect that the creatinine concentration here is more than 2 mg per dl. Okay, another one, we have here the differentiation between maternal urine versus your amniotic fluid. In a case like, for example, there's a fluid leaking, coming out in the mother, so you don't know if that one is a urine of the mother or amniotic fluid, then you need to differentiate that one. Kung urine yan, it might be because of accidental bladder puncture when you're having the parasynthesis. It's the procedure where you try to collect your amniotic fluid. Or it might be amniotic fluid because of the premature membrane damage in the amniotic sac of the mother. So for you to check here the fluid is a urine or amniotic fluid, then we have here the parameters. Okay, so your BUN creatinine is our parameter for assessment. Okay, for BUN value here, that one is amniotic fluid, so it would have your only less than 30 milligrams per dl, but if your specimen is urine, it could go as high as more than 300 milligram per dl. For the creatinine, if that one is amniotic fluid, most likely that one is less than 3.5 milligrams per dl. But if that one is a urine, the creatinine value could go as high as more than 10 mg per dl. Another test for differentiation, for you to differentiate that one, we have your Fern test. Okay, so you just get that fluid and then try to make a smear air dry and then try to examine under the microscope. If you happen to see a Fern-like crystal under the microscope after drying it up, then that's positive for amniotic fluid. Pero pag wala ka makitang Fern-like crystal, so mean to say your specimen is a maternal urine. Okay, then we have here the indications. Okay, when to perform here the amniocentesis to check for the abnormality. The first one, we have here your triple tests, which are your alpha-fetoprotein, your beta-human chorionic gonadotropin, and your estriol would have abnormal result. Pag abnormal siya, mean to say there's something wrong. Therefore, you need to perform amniocentesis to check for that. Or you could have your quadruple test here. That's your triple test plus your inhibin A are also abnormal. Another one, defects would also be manifested here with an ultrasound. Ultrasound would try to check here for the body size of the baby relative to its age of gestation. So pag medyo hindi siya compatible with the age of gestation as to the size, means there's something wrong with that. Okay, then you could perform here also chromosomal defects with the use of your fetal epithelial cells here in your amniotic fluid by performing the karyotyping. You could also perform here your fluorescent in situ hybridization. You could also have here your fluorescent mapping, spectral karyotyping. Okay, or your sky, spectral mapping, fluorescent hybridization. They could also have here your DNA analysis for that. Okay, so when are you going to perform here your amniocentesis? Okay, so ideal for performing amniocentesis here during 15 to 18 weeks age of gestation for the following conditions. Number one, the mother is more than 35 years old during the pregnancy, so medyo risky na yan. Another one, family history of chromosomal defects like trisomy 21 in case of your Down syndrome. Another one, we have parents carry here abnormal chromosome gene rearrangement. Number four, we have here early pregnancy or the previous pregnancy having a birth defects. So there's also higher chance for that the next baby will also have your birth defects. And the fifth one, we have here the parents try to carry here chromosomes which try to code here for certain metabolic disorders. So again, the baby will also have higher risk here of having that. So before siya ipanganak, then you might have corrected already or might have already managed the condition to prevent here or to reduce the side effects of chromosomal defect metabolic disorder here when the baby were going to be born. On the other hand, you could also perform the amniocentesis here during 20 to the 42nd weeks age of station for number one, for assessment of the fetal distress in the case of your fetal lung maturity, and you could also have here for assessment of the infections. Okay, so amniocentesis here a process whereby you try, it's a needle aspiration technique where you try to insert a needle to the abdomen of the mother directed to its uterus, to its amniotic sac in order for you to collect the amniotic fluid. But that one is being guided by the ultrasound para hindi ka you were able to puncture it correctly. Okay, so ideal time for performing your amniocentesis here would be 14 weeks. 16 weeks here for chromosomal studies. And for the fetal distress here is being done later part. So, mga 20 to 42nd pa siya. Okay, then we have your guidelines when we are handling the amniotic fluid here for the different tests. The first one, for the test for your bilirubin. So bilirubin is highly photosensitive pigment, so it should be protected here from the sunlight. You put your specimen in amber colored bottle and make sure that one is not directly not on the direct heat of the sunlight to prevent the photooxidation. The second one we have here for the fetal lung maturity. In the fetal lung maturity, your specimen is the phospholipids. For the phospholipids here, so proper handling of that, you transport it on ice or you could frozen that one up to 72 hours. For chromosomal studies on the other hand, so the best way to preserve that one is your room temperature, even 37, which is your body temperature. Okay, for your chemical testing, so when you're collecting a specimen, you try to separate your cells here from your supernatant as soon as possible by centrifugation or even by filtration. Again, filtration is the recommended process of processing your specimen if you're dealing with your phospholipids in the case of your fetal lung maturity to prevent here distortion of your cells if you are using the centrifugation process. Okay, next one, we have here the color and appearance of your amniotic fluid. So the normal color or the appearance of your amniotic fluid, it should be colorless. Sometimes if you receive amniotic fluid here that's red in color, and that might be related here to your traumatic puncture when you are doing your amniocentesis. It might be related also here to your traumatic or your abdominal trauma. It may also be related here to your intra-amniotic hemorrhage. Dark yellow specimen signifies high concentration of your bilirubin, which is the breakdown product of the red cell destruction in the case of your hemolytic disease of the newborn. Then we have also here green, dark green, will be signifying the presence of the meconium. Meconium is the first bowel or first na stool or dumi ni baby. The problem with meconium here is since dumi siya, kung sobrang dami niya, it's toxic to the baby. Then we have also here dark red brown, so that's would signify fetal death. Okay, RIP.